Oh.
Perfect.
That was great.
Good. There we go.
Oh.
There we go. Good. Good. So, looks like you're moving better. How do you feel?
No, I feel much better, yes.
Good. Okay, so tell me a little bit about what's going on. I saw you're having some issues with your hip, your low back, and your neck as well.
Yes.
Okay.
Yeah, my hip situation's really bad. It's kind of distracting me from my neck. I've had neck issues for several years now,
Okay.
or I say neck. It really ends up being like my shoulder, but
Gotcha.
you know, it goes like all the way up. And that used to be really difficult for me to sleep, but now I'm very distracted by my hip pain, and that's probably because I started working an off job and then maybe stopped being as active as I was.
Yeah.
I'm not really sure actually, but I've also noticed that I think they might be higher just because when I put my feet out, like one leg is shorter than the other.
Okay.
And that's the hip that really hurts.
So it's this left hip?
Yes, my left hip.
Okay.
And like I always call it my hip too, but it's like my lower back, like that whole area.
Yeah,
it's
kind
hard
of where your low back meets your pelvis?
Yes.
Okay.
It's very painful. My mom helps me like she's like, it's your piriformis. I'm like,
Okay.
okay. That's
Yeah.
my mom's the diagnosis. She always tries to help me with
She's
that.
in the right location.
Okay, well,
Yeah.
she knows. She'll really go and try to rub it for me. But yeah, and I think with this, it's like going up my whole back. Like this area feels a little swollen too.
Okay.
And I think that I just am due for a good adjustment. I don't know.
Have you been to the chiropractor before?
Yes, a few times.
How long ago was the last time you were adjusted?
It's been a minute. It's definitely. It was cold outside, so it's definitely. It was like this last winter. I think it's been a hot
It's about a year.
Yeah.
Okay.
Maybe.
So the hip pain, how does it feel? Is it more like dull, achy, and tight? Is it sharp and stabbing? Does it burn?
I would say like the muscle definitely like feels tight, but it also like sometimes burns.
Okay.
Yeah. I hope I'm like describing it correctly.
Yeah.
I always, when I was looking at the words on the intake form, I was
Yeah.
like, what does it feel like? I was like, which one of those are what I feel?
Sometimes it can be hard to describe.
Yeah, I just wasn't sure what exactly it is.
Does that sensation go down the back of your leg or anything like that?
Not too bad on my legs, no.
No
I don't think
numbness, tingling, weakness? No. Okay. So it just feels kind of like locally right around this area.
Yes.
What types of things make that worse?
Sitting.
Sitting.
Yeah,
The longer
sitting.
you sit, the worse it gets?
Yeah, I think about it more. I think when I'm sitting, and like sitting up in bed is just not comfortable. I have to sit, when I sit on the couch, I like put a lot of pillows and like stuff so I can like sit more straight.
Yeah.
I don't know, my couch is also like kind of worn in, so I feel like that
You're
doesn't help my
sick.
posture like and
Yeah.
everything. So I recently started working from home too, which is not helping the situation at all.
Yeah.
Because the places I'm sitting are not.
Yeah, work from home has been hard on everyone.
Yeah, no, I
because your
agree.
workstation's not ideal.
No, it's not. So I'm trying to stay like away from my couch. Like I even sit on the floor now more often.
Yeah.
So I can like lean forward onto something.
Right.
But sitting is probably worse.
And how does the like kind of neck, shoulder pain feel? Is that more like achy, dull, tight, or is that more sharp?
I feel like it's might be more achy. I think
Okay.
I just find myself like always just like doing this.
Trying
I
to
don't know,
rub
like
it,
trying to rub
yeah.
it. Yeah. Moving things around.
So more so just like uncomfortable,
Yeah, I think so
tight.
for the most part.
Okay.
But that's how that goes.
Yeah. So what we'll do is we'll just kind of see how well you're moving overall, and then we'll kind of check out your spine, see what's going on, and see if we can figure out what to do with you, and then we'll get
Okay.
you adjusted, okay?
Okay, that sounds
Cool.
great.
So let's have you just sit up nice and tall for me. You're
Okay.
going to bring your chin down to your chest as far as you can. Okay. And then look up towards the ceiling backwards as far as you can. Good. And then look over your left shoulder, and then over your right. Okay. So we're moving pretty good. We look pretty even from left to right. Maybe a little bit stiff coming down. When you went down like that, did you feel like a pulling?
Yes, for sure.
Okay.
I always am like doing this.
Yeah, trying to stretch.
Yes.
Okay.
Always.
Let's have you stand right here with your feet together. You'll face towards the door. And then go ahead and reach down, touch your toes as far as you can. Any pain in the hip there?
Not pain. I would
Okay.
say. I mean, like, I'm stretching. It's not like
Yeah.
really, but like I don't think it's like painful.
Okay. Let's have you lean back as far as you can.
I don't really like that one.
Okay.
I do
No.
that at home all the time, and then I always do it because I think that I'm gonna pop something, so it
Yeah.
feels like, let me do that. I always try to adjust myself.
And then it doesn't pop?
No, right. Sometimes it will. Like if I lean like this way, I try to like maneuver it.
Yeah.
I know that's not good for me, but psychological. I think
Yeah,
sometimes.
as long as it doesn't make it feel worse, it's not that terrible.
Oh, okay. People I know that people are like, you shouldn't pop stuff.
Yeah.
But anyway.
Some patients, you'll pop something and you feel worse afterwards. In that case, probably
Probably
want to
something
avoid
like
that. But
yeah.
if it doesn't hurt worse or it even brings you relief, it's not terrible to do
I just
it.
know when I lean back, I definitely like, feel it
Yeah.
in there.
Okay. Well, let's do this. Let's have you go face down. Your face will go right here where the paper is.
Okay.
And there's a little handle right there by my foot that you can grab onto.
Okay.
Okay. Comfortable?
Yes.
So if I go here, is that painful?
A little bit.
Okay.
Not like anything terrible though.
What about here?
I feel it because you're like, I feel like you're tugging on the other side. Is that what you
Yeah,
think?
but not as bad?
No.
Okay. And what about here?
I feel it doesn't hurt like in that spot, but it hurts my hip.
Gotcha. And what about there?
Yeah, it hurts a little bit.
Okay. So we definitely have some tightness going on here on this left side of your hip. So I think if we can get that SI joint moving a little bit better, that you'll feel better. And then you kind of just feel it radiate up through the whole left side, is that right?
Yeah.
Okay.
Some days are just enough.
Yeah. Okay. A little bit with these ribs here.
Mm-hmm.
Yeah. Okay. So let's start with these ribs right here. So let's have you go ahead, roll over onto your back for me. And we'll scoot you down on the table a little bit. Perfect. A little more right there. Okay. So what we're going to do is you're going to put this hand on the back of your neck, just like that. And then my hand's going to go underneath you. Yeah. Okay. So my hand's going to go right here. And then my other hand's going to go kind of on the front of your ribs here.
Okay.
So we're going to go right there. Good. Okay. Deep breath in. Out. Loose shoulder. Good. Felt okay?
Yeah.
So we're going to do something similar on this side.
Okay.
So put this hand on the back of your neck. Good. Okay. Good. All right. Deep breath in. Out. Good. A little bit tougher on that side.
Yeah.
Okay. Let's try this. We're going to cross those arms here. Good. I'm going to roll you a little bit. Okay. Breathe in. Out. Good. Loose shoulders. Ooh. There we go. And again. Out. Good. Oh, there we go. A little better on
Yes.
those. Some of those are a little rough, huh?
Yeah.
Okay, let's have you go face down again. We'll try a couple different ways to work on those ribs. So I'll have you drop your arms back up off the top. Perfect. Okay, so my hand's gonna go under your hip here, and then just let your belly be nice and loose for me. I'm gonna use this kind of like a handle. We're gonna give you a little push. Good.
Oh.
There we go. That moved a little easier for us. We'll try one a little bit higher. Good. Okay. Then we'll go to the other side. Same thing, just leave that belly nice and loose. Good. Okay, one more. Okay. All right. And let's have you take a deep breath in. Out. Let those shoulders fall. Good. Okay. Not bad there. Let's have you roll on your side. You'll face me over here.
Okay.
Good. So your head will go right there. And then we're going to adjust this hip. So your bottom leg will be straight.
Okay.
Your top leg will be bent. We'll bring you a little closer. Good. Just like that. And then we'll go here and here. Comfortable for you?
Yes.
Okay. Yeah, right in here. Okay. Breathe in. Out. Good. Okay, one more. This arm's going to go overhead this time. Perfect. Okay, breathe in. Out. Good. Okay, other side. Okay, same thing but backwards. So bottom leg straight, top leg bent. No, you're fine. I have patients who've come in like 20 times and they're like, I still don't remember what to do. Okay, breathe in. Out. Good. One more. Breathe in. Out. Good. Okay, good. Now we'll have you lay flat on your back. And we'll have you scoot up towards me just a little bit. Okay. Not too bad up here. A little tender right there.
Mm-hmm.
Yeah. Okay, I'm going to lift you up. Good. And let me have all the way to that head. Perfect. Perfect. Doing okay?
Oh, yes.
Okay, other side. Good. Nice and easy, I gotcha. There you go. Good. Felt okay?
Yeah.
All right. Let's have you scoot down just a little bit for me. We're going to do some decompression with you. So let's have you lift that head up for me. Good, and then set it down. Perfect. Now if I pull here, no pain or anything, right?
No.
Okay. So we're going to give you a little pull. Good. Deep breath in. Out. Good.
Oh.
Perfect.
That was great.
Kind of a crazy one, huh?
Yeah.
Okay. That helps open everything up.
That was nice.
So now let's have you go face down one more time for me. Good. And arms up top. Let's scoot you down just a little bit. Good. Okay, we're going to do a couple drops with the table here. So the table's going to come up and it's going to fall down like that a couple times.
Okay.
It's going to help me use gravity to adjust this hip. So we're going to go here. Is that okay? Good. Okay, perfect. Good. Okay, so I got everything moving pretty well there. So let's have you hop up and we'll try some of those movements again
Okay.
and see how they feel by comparison. So we'll have you do your toe touch.
Okay.
Good. And then come on up, bend backwards. And how's that feel?
Not as bad.
Good. And then let's have you go ahead and have a seat again. And let's look at some of those neck movements. So you go chin down to your chest. And how's that feel?
Much better.
Yeah. And look up towards the ceiling. Good. And then to the left. And then to the right. Yeah. So looks like you're moving better. How do you feel?
No, I feel much better, yes.
Good. Okay. So, you don't have anything too crazy going on. I know you'd rated the hip at about like a 4 out of 10 in terms of pain when you first were filling out your paperwork. How would you rate the hip when you first came in today?
Today my wavy was not as bad.
Yeah.
I've been kind of distracted today.
Right.
I've been like with work and
Haven't
everything.
been
I
thinking
haven't been
about
paying
it.
attention to it as much, but I don't think it was as bad as the other day. I was like filling out the form.
While you're suffering?
Yes,
Yeah.
like this is terrible, but I don't think it was like maybe a 3.
Okay. And how does it feel now?
We're good right now. I don't really
Don't feel
what's
it?
going on right now. Maybe later, but right now I don't.
Well, that's what we're looking for,
Yeah.
right? So, well, perfect. So I think probably what we'll do for you is we don't need to see you super often. I'd probably say every other week for a
Okay.
little while, so about twice a month.
Okay.
We'll just keep things moving well, and then we'll kind of go from there.
Okay.